This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: what are purine salvage deficiencies? Answer: purine salvage deficiencies refer to a group of genetic disorders in which the body is unable to properly recycle purines, which are nitrogen-containing compounds that are a fundamental component of DNA and RNA. This leads to a buildup of toxic levels of purines in the body, which can cause a variety of symptoms, including neurological problems, developmental delays, and immune system dysfunction. Question: what are the causes of purine salvage deficiencies? Answer: purine salvage deficiencies are caused by mutations in genes that are involved in the purine salvage pathway, which is the process by which the body recycles purines. These mutations can occur in any of the enzymes or transporters involved in this pathway. Question: what are the symptoms of purine salvage deficiencies? Answer: symptoms of purine salvage deficiencies can vary depending on the specific type and severity of the disorder, but may include developmental delays, neurological problems, immune system dysfunction, and anemia. Question: how are purine salvage deficiencies diagnosed? Answer: purine salvage deficiencies are typically diagnosed through a combination of clinical examination, blood tests, and genetic testing. A blood test may be used to measure levels of purines and other related compounds in the blood, while genetic testing can be used to identify mutations in the genes involved in the purine salvage pathway. Question: how are purine salvage deficiencies treated? Answer: treatment of purine salvage deficiencies typically involves managing symptoms and preventing complications. This may include therapy to address developmental delays, medications to manage neurological symptoms, and treatments to support the immune system. In some cases, a low purine diet may be recommended. There is no cure for purine salvage deficiencies. Question: are there any complications associated with purine salvage deficiencies? Answer: yes, there can be a variety of complications associated with purine salvage deficiencies, including anemia, gout, kidney stones, and neurological problems. These complications can be severe and may require additional treatment or management. Question: are purine salvage deficiencies inherited? Answer: most purine salvage deficiencies are inherited in an autosomal recessive pattern, which means that an individual must inherit 2 copies of the mutated gene in order to develop the disorder. However, there are some types of purine salvage deficiencies that can be inherited in an autosomal dominant pattern, where only 1 copy of the mutated gene is needed. Question: is there a cure for purine salvage deficiencies? Answer: unfortunately, there is no cure for purine salvage deficiencies. Treatment typically focuses on managing symptoms and preventing complications. Some studies are ongoing to find a cure for these disorders. Question: are there any new research or treatments for purine salvage deficiencies? Answer: researchers are currently investigating new treatments for purine salvage deficiencies, including enzyme replacement therapy and gene therapy. These treatments are still in the early stages of development and not yet available for clinical use. Regularly monitoring of the development and research will give an updated information. Question: how common are purine salvage deficiencies? Answer: purine salvage deficiencies are considered to be rare genetic disorders. The exact incidence of these disorders is not well known, but it is estimated that they affect only a small number of individuals worldwide. Question: can purine salvage deficiencies be prevented? Answer: purine salvage deficiencies are genetic disorders and cannot be prevented. However, early diagnosis and appropriate management can help to prevent or reduce the severity of complications associated with these disorders. Question: are there any support groups or organizations for individuals with purine salvage deficiencies? Answer: yes, there are organizations and support groups that provide information, resources, and support for individuals with purine salvage deficiencies and their families. Contacting a local genetic counselor or a medical professional can provide more information about these resources. Question: are there any dietary restrictions for individuals with purine salvage deficiencies? Answer: individuals with purine salvage deficiencies may be advised to follow a low purine diet, which typically involves limiting or avoiding foods that are high in purines, such as organ meats, anchovies, sardines, and certain types of fish. Consultation with a medical professional can provide more detailed dietary recommendations.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You could find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.